What is deep intelligence? For us at Canon Medical, it encompasses many things. Introducing the Aquilion ONE PRISM Edition. AI-assisted imaging is deep intelligence, combining the power of our advanced intelligent ClearIQ engine with Spectral Deep Learning Reconstruction is deep intelligence. Being able to distinguish true signal from noise to deliver exceptional scans without compromising on speed and dose is deep intelligence. An integrated end-to-end spectral workflow that includes a 160mm volume scan and an extensive suite of spectral analysis applications is deep intelligence. With the new Aquilion ONE PRISM Edition, deep intelligence is integrated into every scan, for every patient, now and long into the future.
At Canon Medical, we strive to provide innovative CT solutions that make some meaningful impact to patient care. The Aquilion ONE PRISM Edition is no exception. Designed for deep intelligence, Aquilion ONE PRISM Edition uses AI-assisted imaging, including advanced intelligent ClearIQ engine, that is AICE, and Spectral Deep Learning Reconstruction. Today, we'd like to introduce our latest update to the Aquilion ONE PRISM Edition. Let's get started.
Introducing Precise IQ Engine. Canon Medical's Super Resolution Deep Learning Reconstruction for CT. Designed specifically to deliver sharp cardiac images. Overcome the challenges of coronary artery visualization in heavily calcified vessels. Trained by Canon's precision 0.25mm ultra-high-resolution CT data to improve visualization of cardiac stents and plaque. Experience improved diagnostic confidence with detailed and accurate images. One-beat coronary CTA examinations with Precise IQ Engine. Simple, clear, and precise. Powered by Altivity. Only from Canon Medical. Made for life.
Hi, my name is Zhou Yu. I'm the Director of CT R&D at Canon Medical Research USA. We are the North American Research Center of Canon Medical System. Here we perform advanced research for next-generation scanner technology. At Canon Medical, we have always been pushing the envelope of technologies. In the past, we introduced the first wide-coverage CT scanner, allowing cardiac scan to be done with a single heartbeat. In recent years, we launched ultra-high-resolution CT, the precision scanner, featuring 250-micron detector size at ISO center, and deep learning-based reconstruction, AICE, allowing doctors to see through the noise and reduce patient dose. The question we always ask ourselves is, what is next? How do we bring these technologies together, and what can we enable this time? We came up with the idea to bring high resolution to wide coverage scanner using deep learning technology. The core technology of PIQE is deep learning-based super resolution algorithm. Super resolution is a class of algorithms to increase resolution of imaging system. It has been used in our daily life, from satellite imaging to digital photography. Traditionally, super resolution is done by oversampling and optical modeling and deep learning algorithms. Recently, with deep learning, we have seen an explosion of new advancement and a successful application of deep learning-based super resolution. To develop super resolution algorithm for CT, we need 3 key ingredients. First, we need a high-resolution training target. At Canon, we have unique access to ultra-high resolution CT data from our precision scanners. The scanner is commercially available, allowing us to access real clinical data for training through our partners. The reconstruction of the target image incorporates system optics model that can maximize the resolution from our high-resolution scanner. Second, we developed advanced deep learning-based denoising algorithm to preserve the inherent resolution of the system. In CT, the enemy of high resolution is noise. To minimize patient dose, we often have to implement denoising algorithm that will also sacrifice spatial resolution. As a result, we rarely get the maximum resolution the system can provide. With deep learning reconstruction, we have redefined this resolution and noise trade-off. In PIQE, conventional denoising have been replaced with deep learning denoising, allowing this inherent resolution of the system to be expressed. Third, we developed an advanced neural network architecture. Our team has investigated many neural network architectures in the past. For PIQE, we developed a 3D neural network. Most people in the field today use 2D neural networks. The challenge is that it is hard to differentiate small features like small vessels from noise in 2D. With 3D neural network, the network has additional information from adjacent slices to differentiate these small features versus noise. With all the technical ingredients put together, it is also important to incorporate clinical knowledge into our development. In the end, it is the clinician who reads the image and makes diagnosis. To do that, we work closely with clinicians to understand the clinical use case, the image quality preference, and fine-tune our training target and training method to maximize the image quality. With all the efforts behind development of PIQE, we see great potential for PIQE to improve the quality of cardiac imaging by reducing blooming artifacts from calcium and stent, improving visualization of small vessels, and reducing noises. We are excited about this technology, and we look forward to see it being used in the field. Together, let us advance cardiac imaging for better patient care.
I'm Dr. Marcus Chen. I'm the Director of Cardiothoracic Imaging at the National Institutes of Health in Bethesda, Maryland. If you're not familiar with the NIH is the largest biomedical research facility in the world. Our goal is to improve healthcare for everyone. For the last 12 years, we've had a collaboration with Canon Medical to improve CT technology and image quality. Over the past 12 years, we've had 5 different Canon CT scanners. In 2009, we invested in the Aquilion ONE because we felt that the best way to image the heart was to image it at one time with wide volume technology. Being able to image the heart in one heartbeat has many advantages. In 2015, we had a prototype ultra-high resolution CT system that had 4 times the resolution of a normal CT scanner and had a slice thickness of 0.25 millimeters. In 2020, we upgraded to the Aquilion ONE PRISM, which has spectral imaging. Over the last year, through our cooperative research agreement with Canon Medical, we've been working on PIQE image technology. PIQE uses ultra-high resolution images as a basis to train the deep learning reconstruction to improve image quality and improve spatial resolution. What I'm most impressed with PIQE is that it's as if you're wearing glasses for the first time. I can now see very fine detail. I can see small areas of calcification. I can see small stent struts, and I don't know what I've been missing before. Let me show you a case. In this right coronary artery, there are multiple areas of calcified and non-calcified plaque. What I'm most impressed with PIQE is its image quality. It has incredible sharpness and detail. The amount of blooming from these calcified areas are minimized with PIQE reconstruction. I want to highlight the high image quality with PIQE with the second case. Here is some areas of small spotty calcification that's really difficult to see on the traditional image. However, with PIQE, you can see these small, tiny specks of calcium. Spotty calcification is a high-risk plaque feature. And with PIQE, we're now better able to see these small details and provide better care to the patient and provide more prognostic information from a cardiac CT scan. I'm going to share with you a third case, which involves a stent, which is always challenging to visualize. On PIQE imaging, we're now able to see the individual stent struts, whereas on the traditional imaging, it just looks like a blur. With PIQE imaging, we're now better able to visualize inside the stent and make a diagnosis whether or not a patient has in-stent stenosis. I've been very honored to work with Canon Medical in the development of PIQE. Overall, I think PIQE is an incredible technology. With it, I'm able to visualize smaller structures and be more confident in my diagnosis. It's completely integrated into our workflow. We don't have to wait minutes for these reconstructions. They're available in seconds. Because I'm able to see smaller structures more clearly, I know that I'm making better diagnosis and delivering better health care for the patient.
PIQE の画像は、鏡子画像に高精細 CT の画像を使ってますので、通常の CT スキャンをしてるんですが、非常に分解能の高い画像が得られるというのが非常に特徴です。で、具体的に言えば、例えば心臓の冠動脈の、中に入れた、ステントとかのストラットなんかも非常に明瞭に描出することができますし、冠動脈についた石灰化のブルーミングなどもかなり低下している印象です。で、今後は、まだ研究段階ではありますが、ソフトプラークの中の脂肪とかも病質の方が向上するんじゃないかと個人的には期待しています。今回のPIQEはテクスチャーが非常に自然なテクスチャーで、それからノイズが非常に低下して見えます。で、ノイズは特にですね、低周波ノイズの抑制が強いんで、本当にテクスチャーが自然な感じで見えているというのが特徴だと思います。低周波ノイズがおそらく改善されるということは、病変の検出能が上がっている可能性が高いんで、そういう意味でもCT をよりというか診断能の高いものにする技術かなと思っています。空間分解能のみならずコントラスト分解能も改善する可能性がある。
In 2020, lung cancer was the leading cause of cancer death worldwide, with an estimated 1.8 million deaths. Studies show that screening with low-dose CT for high-risk individuals can help diagnose cancer early, when successful treatment is more likely. Meet SilverBeam, Canon Medical's new solution for low-dose lung CT. Maintaining the detail of a CT at dose levels closer to an X-ray. SilverBeam selectively removes low-energy photons to reduce dose and optimize the beam energy. When combined with our advanced intelligent PIQE engine, this beam-shaping energy filter harnesses the power of AI to deliver high resolution and low noise. For applications such as lung screening, maintaining the detail of a CT at dose levels closer to an X-ray. This is SilverBeam. Only from Canon Medical, made for life.
The NIH has been working with Canon Medical on SilverBeam technology. SilverBeam is a filter that's applied to the X-ray spectrum to better visualize the lungs, but at the same time reduce the X-ray dose and to work in conjunction with deep learning reconstruction. So with SilverBeam, we're better able to see the lung parenchyma. The images are sharper and there's less noise in the soft tissue. And we're now able to see more subtle details such as ground glass opacities, which can be difficult to visualize, and more accurately measure lung nodule sizes. And at the same time, reduce the noise, especially in the soft tissue. And overall, we're able to significantly reduce the radiation dose, which improves patient safety. Overall, I'm very excited by the SilverBeam filter. It improves image quality and it reduces the amount of image noise. What I'm most excited about is how much it's able to reduce radiation dose while preserving overall image quality and diagnostic accuracy. I've had patients who are reluctant to come in for a chest CT because of the fears of radiation. However, now with the SilverBeam filter, that removes that barrier. And now we're able to offer ultra low dose chest CT for screening for lung cancer, and that's a game changer.
We are very excited to bring you this new version of the Aquilion ONE PRISM Edition. We hope these additions will improve your ability to provide superior patient care with fast diagnosis and improved clinical confidence. We thank you for taking time to join today's launch.